Arizona recently received federal approval to develop proposals that could lead to work requirements for some Medicaid recipients, and that's led to some pushback from civil advocacy groups. Currently, Arizona has a request in to get some federal Medicaid rules waived so it can implement new eligibility requirements for what it considers able-bodied adults between 19 and 55 years old. Things like working or attending school for at least 20 hours a week. More than a dozen exemptions applied. I asked Governor Ducey's health advisor, Christina Corieri, to explain why Arizona is interested in rolling out these requirements.
I think the reason people are looking at this now is because we had done work requirements for most welfare programs back in the 90s. So we did them for cash welfare, known as TANF, and also for food stamps for able-bodied adults. So some people might ask why we didn't do Medicaid then. We didn't do Medicaid then because it was a different program then. Medicaid in the 1990s was largely for elderly, poor, for the disabled, for children, and for pregnant women. You didn't have able-bodied adults who were on the program. The program has evolved, and that's why it continues to evolve with new waivers like this.
There are already able-bodied adults who are working and receiving Medicaid.
Arizona expanded Medicaid like several other states. That brought the program eligibility up to 138% of the federal poverty level, whether you were able-bodied or not.
Outside of the emotional component, are there some other challenges that you would anticipate with this with this requirement?
Well, I think first we have to explain the requirement to people, right? You have a lot of folks that think this applies to everybody. That is absolutely not true. This is a very narrowly crafted work requirement that applies only to able-bodied adults between the ages of 19 and 55. Furthermore, it provides many exceptions even within that group. So if you're going to school, if you're going to a work training program, if you are a caretaker of a young child, if you're the caretaker of a disabled relative or an elderly relative, there are exceptions built in for that.
Why do you suppose this is being met with such resistance?
I think change is always scary for people. I think people always assume that it's going to affect everybody, and that's not true. You have people who have legitimate disabilities who can't go back to work. We understand that. I think they might not yet understand that this won't apply to them. So some of this is just communication, and we'll be working on that.
If this goes through, how does it change the state? What sorts of things will be different?
Well, if it goes through, we'll be helping get people refocused on how can we get them back to work. We'll be incentivizing people to re-enter the labor market, and that's a good thing.
This month, 21 organizations wrote a letter asking the Health and Human Services Secretary to reject Arizona's waiver request. Rose Daly-Rooney is legal director for the Arizona Center for Disability Law, which signed that letter. She explained some of the chief concerns.
People with disabilities, people who are on these programs, many of them do want to work, and they actually do work. I mean, studies have shown that many people work who are Medicaid eligible, and that actually having these benefits helps them be able to work. Because if you can manage your health care and you can stay on top of your health, it's easier to maintain employment. It also shows that when people don't have good health care, and can't manage their health care, they lose their job.
Are the exemptions perhaps too broad or maybe not detailed enough?
What strikes us in part about Arizona's system is that it does include 14 exemptions. It creates a reporting requirement that is going to be very difficult. For example, what if you have multiple employers? What if you do contract work or independent contractor work, and then you can't establish that you're working at least 20 hours a week during some things? You get knocked off your coverage, and then your health care suffers. And also, Arizona has requested a waiver to be able to, instead of one time a year proving you're eligible, having to prove you're eligible 2 times a year. When you live at the edge of poverty, doing paperwork for the government is one of your lower priorities, and we're afraid that people who actually meet these requirements will be cut off from coverage because they can't keep up with the paperwork. Where do they go when things exacerbate? They go to emergency rooms. And so then federal and state taxpayers are paying for those public hospitals to provide emergency care.
You know, for some, this conversation may seem very black or white. You're either for it or you're against it. Are there things that people should consider as they're watching these discussions unfold?
This is a as I've heard said by others, a solution seeking a problem. There isn't a problem here in terms of people finding work and attempting to find work. And the obstacles that do pose the difficulties in finding work for that percentage who are looking for work and have been able to find it are not going to be served by harsh penalties that kick people off of coverage.